Hello everyone, welcome back to The Colorectal Surgeon. I am Dr. Samrat Jankar, board certified colorectal surgeon and fistula expert. Today we are going to talk on one of the very important topic which always comes with confusion and anxiety. That's having IBS, diagnosed IBS, risk of colorectal cancer. Many of our IBS patients, when they come for frequent follow-up or treatment, they always ask, is this IBS disease which I am going through, is it going to increase my risk of colorectal cancer? So let's dive into the topic and see the fact available and separate the fiction related with IBS treatment. In this video, we are going to see what is IBS, how it differs from IBD. IBS is Irritable Bowel Syndrome. IBD is Inflammatory Bowel Disease. How it differs from IBD. And most important question is whether the IBS increase the risk of colorectal cancer as does IBD, or is it decreases or doesn't has any effect. Friends, IBS is nothing but Irritable Bowel Syndrome. It's nothing but it's a functional disease of your GI system where there is no actually pathology inside, but we are having frequent symptoms such as abdominal bloating, abdominal pain. Some patient may have diarrhea, some patient may have constipation, persistently poor quality of life. In term of IBD is nothing but inflammatory bowel disease. Here it is a disease, there is a problem. Inflammatory bowel disease might be ulcerative colitis, might be Crohn's disease. Because inflammation is there in the colon. IBS is irritable, it's not inflamed. IBD is having inflammation in the colon. It increases a risk of colorectal cancer. But IBS doesn't has effect on the colon as good as what we see in IBD. Usually what we see in the literature is risk of colorectal cancer increases with IBD, not with IBS. In fact, there is a very good thing to know that some of the literature is telling that IBS reduces the risk of colorectal cancer. Why so? It has been published in many of the literature, World Journal of Gastroenterology, and many of the good evidence is there. The straight correlation between having IBS doesn't increase the risk of IBS, and few of the literature are pointing out that IBS reduces the risk of colorectal cancer. Why it's so? Because IBS patients are having symptom. If I am normal being doesn't has any symptom, I doesn't visit the gastroenterologist or colorectal surgeon. But these IBS patients going through, it's a really very terrible poor quality of life. Some patient may have milder form of the symptomatology. Some patient may have more problem because the problem is not solving. In fact, medicine as it also, if suppose I am having fever, take the medicine, fever gone. So IBS patient, it doesn't happen like that. So because of frequent visit of the doctor, because taking proper dietary, they are following low FODMAP diet, following the dietary practice, because they are going to a doctor asking that I want to get investigated, multiple time ultrasound, sometimes CT scan, and also patient get a frequent colonoscopy frequently because of the change in the symptomatology. Because of all these things, there is possibility that this patient will diagnose or screen out their colon early. If there is precancerous, that is polyphyidal stage, if at all, the colorectal surgeon or gastroenterologist just remove them. So your risk of colorectal cancer reduces if we are having IBS as compared to other. This has been put in many of the published literature. Here it is essential to debunk the common myths of IBS. IBS is not any early sign of colorectal cancer. IBS does not increase your risk of colorectal cancer. In fact, it lowers. IBS means we are destined to develop colorectal cancer. It's an myth. It's not like that. However, having IBS, we should not forget that colorectal screening protocol. We know that if age is more than 50, if there is a family risk of colorectal cancer, if we are having higher obesity or any higher obesity is there, in those conditions, we should screen ourselves for colorectal cancer. If we are having warning signs such as blood in the stool, loss of weight, loss of appetite, or having a frequent altered bowel habit, if there is significant abdominal pain or lumpishness, if such kind of thing is there, it's always better to meet the gastroenterologist or colorectal care surgeon and get consultation, and if required, it's better to evaluate further. To conclude, IBS does not increase risk of colorectal cancer. There is enough strong evidence is there. IBS does not increase any kind of risk of colorectal cancer. No need to fear about. And there are some research are available to tell that IBS in fact act as a protective effect or reduce your risk of colorectal cancer, because of IBS patient frequently undergo screening and evaluation and doctor consultation. So having IBS, it doesn't mean that we are immune to colorectal cancer. We should follow routine screening protocols as good as IBS patient has to follow a normal patient like routine screening, colorectal screening protocol, so that we will protect ourselves, and if at all there is a polyp, we can diagnose early. If you feel this video is helpful to understand about IBS and its relationship with colorectal cancer, share this video to someone who is going through IBS and having the anxiety whether it is going to turn to a cancer to me. And if you like this video, press that like button and subscribe our channel, share to many, and let have a healthy colorectal habit of everyone. And if you want more update, subscribe our channel about the colorectal health. We will update more in the next video. If you have any query related with colorectal cancer, IBS, or anything with the colorectal health, put in the comment box, leave your comment. We are there to answer, and we will come with a new video to give more information. Thank you for watching.